What are veneers, and how can they improve my smile?
A veneer is a thin layer of material placed over a tooth to improve the overall aesthetics or the look of the tooth. The most common dental material placed for a veneer is porcelain because porcelain has great strength and is also able to accurately produce a very natural looking tooth. You may have heard of the brand of porcelain veneers called Lumineers that is marketed as a thin veneer that requires no cutting of the teeth. The truth is, any cosmetic dentist that works with a high quality lab is able to produce a very thin veneer and make it very natural looking and very pleasing to the human eye. The issue of whether having to cut a tooth or not really depends on how the natural tooth looks. If a patient comes to our office with a natural tooth that's very inclined forward or inclined outward, if we don't cut that tooth at all, placing a veneer on top of that tooth would result in a final outcome where the tooth is very bulbous and protrudes further outward. In addition, if the natural teeth have a lot of spacing or a lot of crowding, without cutting on the tooth, it's impossible to create a veneer that produces natural looking proportions of the teeth, whether it's the width or the height of the tooth. So whether we have to cut a tooth or not really depends on how the natural teeth look whenever a patient comes to the office. Porcelain veneers have very many benefits. One of the main benefits is producing a more appealing smile. It can correct minor crowding issues without doing braces. It can even dramatically whiten teeth if teeth have colors or stains from certain medications when patients took them younger. It can even help make a tooth a little bit larger if a patient has smaller teeth. If you have any other questions about veneers, please feel free to contact us. We'll be waiting for your questions. Thank you.